Hello and welcome to Docplexus News. The MBBS and BDS admissions are put on hold as the Madras High Court has ordered to award 196 grace marks to 24,000 students who wrote NEET 2018 in Tamil. These grace marks are being awarded as a result of wrongly framed 49 questions due to wrong translation. As a result, students with scores 0 or as low as -100 will also qualify. This has disrupted the admission process and the CBSE is asked to come up with fresh list of candidates. CBSE has opposed this order and has moved the Supreme Court to put a hold on this decision. Central Information Commission has directed MCI to furnish information about Dr. B.C. Roy National Award conferred on the top doctors of the country annually by the President. The Commissioner stated that the process of bestowing national honours cannot be kept away from public scrutiny. Any practice facilitating opacity will go on to diminish the sanctity of the honour and its past recipients. The Supreme Court wants private hospitals in Delhi operating on subsidized government land to provide free treatment to the poor, as was agreed by the hospitals in their lease. The Delhi government will provide periodic reports on compliance with its order to High Court, and hospitals that resist will lose their license. Uttarakhand High Court has directed the Health Secretary to install observer devices in sonography machines in all the private clinics across the state. The decision has been taken to curb the maternal mortality ratio and female feticide across the state. The devices would record all sonographies conducted at the center and would also help to clamp down on sex determination tests. Scientists at the Indian Institute of Science have developed a low-cost simulator for endoscopy. This simulator has been developed to train clinicians without using animal or human patients in virtual reality environment with graphical visualization and haptics. It is useful to bridge the spatial and temporal gap between the patient and the doctor, and also expected to be beneficial in remote medical diagnosis and treatment. Dr. Rata, an orthopedic and spine surgeon from Coimbatore, would take over as the International Chair of AOSpine, which is the largest international society of spine surgeons with more than 8,000 members around the world. He's the first ever person from Asia-Pacific region to have been elected to this position. The government on June 29th had issued a notification banning the commercial production and sale of oxytocin from 1st July. The medical community had raised objection to the sudden ban of the drug that is given to pregnant women during delivery as per the standard guidelines. Thus, the restriction on the private production and sale of oxytocin has been deferred to August 31st. The commonly used antibiotic fluoroquinolone has now come under USFDA scanner due to blood sugar disturbances and observation of hypoglycemic coma in users of fluoroquinolones. USFDA has ordered safety labeling changes for the antibiotics to strengthen the warnings about the risks and make them more consistent. This USFDA warning has alerted Indian doctors to prescribe it watchfully and give adequate instructions to patients. Until now, pediatricians physically go through medical records every time they administer any vaccine, but not anymore. On the eve of Doctors' Day, the Indian Academy of Pediatrics has launched mobile app for child health management and immunization. Let us know more about the app from IAP President Dr. Santosh Soans.
Hello, this is Dr. Santosh Soans, President of Indian Academy of Pediatrics. We are proud to announce the release of an immunization app, that is IAP Medivise Immunization app, under the digital initiative of IAP Action Plan 2018-19. This has been jointly developed by both Indian Academy of Pediatrics and Medivise Solution. This incorporates many important things for the immunization for our patients. It has got an immunization reminder. It has also got the IAP immunization calendar. It has also got the reminder for the patients to alert them of if they miss an immunization. It also incorporates a growth chart where we can monitor their children's growth during these years. This was released in Vadodara on Doctors' Day.
Thank you, Dr. Soanes, for the valuable information. Let us know your views by commenting below. These were the latest happenings in the medical field brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!